Welcome everyone to our Providing Clinical Tele-Behavioral Health Services to Native Youth in the COVID-19 Pandemic virtual learning session. And Mindy, if you could go ahead. This is our second session in the Promoting Mental Wellness Community of Learning that NCUIH is hosting this spring. The series is focused on providing ways to support and enhance the mental wellness of our youth and young adult community members, especially during these times. We have a following session in April, and there will be more information about that after our presentation. Next slide. My name is Emily Baer. I'm Maliseet, and I currently serve as a Public Health Associate in the Technical Assistance Department here at NCUIH. Next slide. Many of you are probably familiar with NCUIH and our mission already. We are the national nonprofit organization devoted to the support and development of quality, accessible, and culturally competent health and public health services for American Indians and Alaska Natives living in urban areas. We strive to improve the health of the over 75% of the AI/AN population that lives in urban areas, supported by quality, accessible healthcare centers. Next slide. Here we have a very brief overview of the agenda for today. We usually start with some general housekeeping, going over Zoom etiquette and information on using the chat, for example, before moving on to our presentations. After our presentations, we invite you to join us for a brief Q&A if you have any questions for our presenters, and then we will adjourn for the afternoon. And next slide. For housekeeping, we wanted to remind everybody that the webinar is being recorded today, and all mics are muted on entrance unless otherwise directed, for example, to ask a question or engage. We do ask that you turn your camera on for interaction. These are held meeting style, not webinar style, just to make it a little bit more engaging. And this is generally a 1-hour session, including the presentations and question and answer session. Questions can be typed into the chat box, and we'll have further instructions in a minute. We have a slide, and slides and recording are always available at our site page, which is ncuih.org/SUNY, and you can find all the past recordings there as well. We have evaluation to follow at the end of the session, and we really welcome your feedback. It's a good opportunity to be able to tell us any topics you want to see in the future, or any kind of presentation advice or styles you're looking to see from us. I'm going to insert that link in the chat box now. So if it's easier, you can just open it now and save it for the end of the session. So how to ask a question or comment in Zoom, just as a reminder for those of you who may be less familiar with the Zoom platform. First, you can select chat at the bottom of your Zoom screen. You'll see a black toolbar, and in the center of that, there should be a chat button if you're using a monitor. Then you can type your question or comment into the chat box, and it will appear on the right. And we actually ask that if you have time, you can try it out now by entering your name, tribal organization, and tribal affiliation and organization into the chat box. So welcome to everybody. We look forward to engaging with you. If we could go to the next slide. I just wanted to introduce our presenters today, Dustin, Richardson, and Shane Lopez-Johnston. We're extremely excited to have them. They represent 2 of our sub-grantees on our Native Connections grant, and they have done a lot of work at their UIOs for this prevention topic, especially with clinical tele-behavioral health. So we really are excited to have them here to share their expertise and wisdom with us. Dustin Richardson is a licensed professional clinical counselor with a background focused on severe and persistent psychopathology as well as trauma. He has over a decade of experience working in public mental health in a variety of settings that include residential, inpatient, outpatient, community, and crisis. He serves as the clinical director of Native American Lifelines in Baltimore. Shane is an enrolled tribal member with the Tolowa Nation. He has been working in the prevention field for the last 16 years and has a Bachelor of Science from Portland State University. Serves as co-chair of the Oregon Youth Authority's Native American Advisory Counselor, co-chair of the Oregon Indian Council on Addiction, and sits on the panel of experts for Oregon's tribal-based practices. As the Prevention and Special Projects Director at the Native American Rehabilitation Association of the Northwest, or NARA, Shane oversees several funding streams that have helped create sustainable infrastructure for the youth program based around the message, "Culture is Prevention." He and team members are working to implement tribal best practices, evidence-based practices to strengthen resilience and protective factors against risk factors that Native youth face. Their goal is that by incorporating culture and tradition into their activities, the youth program hopes to create a future of well-variety for Native youth. Without further ado, I would like to welcome Dustin and Shane and get our presentation started. Thank you, everyone.
Hey there, folks. First off, thank you all so much for joining us today. And I've just been watching the chat. It's nice to see so many folks from across the country. So again, I'm Dustin. I use he, him pronouns if folks prefer. I know for Zoom etiquette, a lot of folks will also like to put that in their title. And sometimes that can be helpful, especially as we switch to discussion later. But yeah, so I figured this is a really exciting conversation and topic for me. I am a total nerd. I have a background in cyber psychology and human-computer interaction, stuff that probably really bores most people, but I find it exciting, so I'm happy to talk about telehealth. So go ahead, next slide, please. All right, perfect. So first off, at Lifelines, we're a Title V Urban Indian Healthcare Program. I'm betting most folks know what that is. And we operate both in Maryland and Massachusetts. We have one site in Boston and one site in Baltimore. In terms of telehealth, we've actually had a form of telehealth counseling for probably about 3 years or so, a little bit more. And yeah, I'll watch the chat and also just try to make sure I speak up just in case your volume might be a little bit low. But in any regard, we have tended to do individual counseling, group therapy, and actually especially art therapy. We do some forms of EMDR as well via telehealth. We have less folks who engage in that. I would say art therapy is probably more popular. But really we've had a lot of folks take very well to it. We've also transitioned really to online events starting in 2020. We've done an online and virtual GONA, and we've really switched over most of our youth events to online platforms as well as pretty much all of our health promotion, disease prevention. Next slide, please. All right, so really one thing I want people to kind of ponder, virtual spaces are environments too. Really, I was told by an elder when I was young, where our community is, where our people gather, that is, where our heart is. And so, whether or not it's going to be in a virtual space, for a lot of our youth in a video game, in Discord, on Instagram, on Snapchat, we're taking part of ourselves into these spaces. They end up impacting our behavior, and they also impact really how we connect to each other and how well we do. Next slide, please. So some key questions that I think that we asked as we were trying to develop our programs and our telehealth, we're really, trying to figure out this first off, what our community needed. That's partially in terms of like diagnostically, what are the needs of your community? For example, in Baltimore, we have a tremendous issue with fentanyl that causes a lot of overdose and traumatic death. Whereas in Boston, we have a lot more issue with alcoholism. With our youth, we tend to have a lot of folks who might be on the autism spectrum or who have, ADHD or similar. So really, who are you trying to reach and what are you seeing? In terms of the environments, I think it's good to try to figure out where your youth are actually most active in. Trying to figure out like whether or not that's going to be Facebook, Instagram. It impacts your advertisement, especially for things like events. And for us, a lot of folks came into our telehealth program after attending an online event. In the same way that like when we used to go out and advertise at a powwow, that might be the time where somebody, comes up to the table, starts talking to us, and then starts talking with us about their issues of, depression, or maybe needing some medication management due to anxiety. What tech do your youth have access to? And this is really important. And when it comes with, our area, in Maryland, every student basically got access to a Chromebook as a part of the COVID relief funds and really trying to get them access to schooling that was online. Whether or not, they're going to have a Chromebook or, maybe a cell phone, there are a lot of our youth who actually don't have access to much. And that's, of course, going to impact whether or not they can get access to telehealth services. Where is your money? I really hope that, hopefully most people have gotten some increased funding, with COVID-19. I know if you're anything like our organization, we've gotten additional funds, but it's just been hard to figure out where to manage and to spend it. But platforms, especially for telehealth, usually are within allowable costs. And I'll get to this later, but the money and the cost of different platforms can vary wildly. Besides that, what are your staff trained in? What's going to move over well to telehealth? What is going to feel appropriate? And even what platforms is it easier to do certain types of therapy or treatment in? Now, for example, like EMDR works very well with a few platforms, and there are actually online sites that will allow you to do a lot of the interventions that you would normally do for in-person EMDR virtually, but it's not with every platform. And finally, what is your capacity? And I think a lot of times with telehealth, it does expand your capacity because it does expand your ability to access, clients you normally wouldn't. At the same time, people can actually be flooded. And I think especially right after the pandemic started, nationally, we saw a big jump in just, the consumption of telehealth and also a lot more people needing mental health services. So things to keep in mind. Next slide, please. Finally, there's also some crucial elements of telehealth. So, I think for a lot of folks, we got pushed into telehealth without necessarily being entirely prepared for it. A lot of states laxed, their policies on what they allow for telehealth. And I know for COVID, I know our organization has just been struggling to meet the demands of the community and also the demands of our funders. So what these mean is sometimes we don't always have the time to plan out things as well as we would like. But some key elements to worry about are things obviously like confidentiality. And this even goes into things like unintentional self-disclosures. Like I see a number of folks having some really cool backgrounds. I appreciate it. Particularly Elizabeth and kind of the like, I almost want to call it like a rainbow stream. Yeah, I appreciate that. People have a lot of unintentional disclosures during telehealth just by having family walk in the background, by having pictures in the background. Even one of the interns I supervised, she had gone on a meeting and I was like, you may not want to have that picture in the background. That's, it's a little bit less appropriate. Making sure that you have policies in place regarding telehealth, and even if you're allowing people to work from home, they're teleworking. Making sure that people are appropriately trained. When I initially got trained in telehealth back in 2017, I did 2 full days training, one of which was at APA. And really, you want to make sure that you have folks who are very competent, who they've been doing telehealth for a while, and that it is something that's going to be useful to your population as well. You're also going to want to look at your setup for both your staff and the clients. If you have staff using one of your machines, how are you going to have that set up? Are you going to make sure that both staff and your clients have access to things like a shutter to make sure that their webcam, isn't going to be left open all the time for their safety. Which, safety I have a bit more on, but, safety considerations are really what kept a lot of people away from telehealth for a long time. You fundamentally just have less control over where your client's coming from, and that can be worrying. And you also really want to make sure that anything that you're doing, at least in my opinion, you're assessing culture, whether or not any issues with technology are going to become a way to inhibit the access to culture, but also how can you integrate culture into whatever you're doing. For example, for our art therapy group, we typically send materials to clients who are engaged in the group, and we also use traditional materials and also non-traditional materials. So whether or not we're doing, virtual drum making, or making a container from quick dry clay, we're trying to see how we can intersperse culture into the intervention, and that leads into trauma-informed care. Really making sure that no matter what you're doing in terms of, whatever method you're reaching a client at, you're keeping an eye on the impact of any trauma history, both historical, intergenerational, and then also individual. Then last is really going to be your platform. Your platform is going to impact a bunch of the items basically for telehealth. And actually, if you can switch to the next slide for me, that'd be appreciated. Because the big problem with a lot of platforms is there's a problem of like security versus usability. A lot of the platforms that I think had come out for telehealth, they were pretty secure in terms of making sure they had the HIPAA compliance, encryption, which is really, really important. You need the data encryption to be technically set in terms of HIPAA compliance. But then you also need to manage the entry and the exit of individuals. And this needs to be like pretty easy in terms of like the user. Otherwise, you don't want the platform to become too stressful. You don't want people to have to, unlock, 5 locks to get to your office. You don't want somebody to have to, struggle just to get onto the session with you. Another big piece is just what device can access it. Some devices, will not work with things like WeCounsel or TheraLink. And that you have to manage even in terms of like what software people use, if they're using an Apple machine versus a Windows. Big thing is how many participants can actually be on. So for example, Zoom, generally for a lot of the meetings, the sky's the limit. If you have a group, you're generally not going to max out the number of people that you can have on that group on a Zoom platform. But things like some of the other programs, again, I'll mention things like WeCounsel, usually that only has a max of about 4 to 8 people, depending on your subscription. And it also impacts how much they can participate. So, for example, with Zoom, you have the reaction like emojis. You may also have for like webinars, whether or not you can raise your hand. Looking at the amount of control and participation you want to have really impacts what you use. And finally, the cost. Zoom is expensive. Zoom is pretty expensive, especially if you're getting the professional version that's data encrypted. But it does give you a lot of features. It's pretty usable. It really meets the requirements for HIPAA. And so that's the positive part of that. But you take other programs, so we'll talk about Doxy. So Doxy currently is actually a free service. It's pretty usable. And the free version, basically, like it's pretty bare bones. You don't have things like a virtual background. You can't have more than one person on the stream at a time. So really it's just individual. But at the same time, it meets the requirements that it needs to meet. So next slide. And again, when it comes with understanding the risk, I do love my native memes. Most of my memes have been sent by young clients, so that's also what I appreciate about our culture. I talked a little bit about the unintentional self-disclosures that can happen online, and I don't know for anybody who's licensed. I've already kind of kept an eye on my board's complaint section and really what people have been written up for. a lot of people, unfortunately, I think as COVID continues and even ends, are going to come up for issues where they violated client confidentiality, oftentimes by not being in a secured environment. I think there's also a big issue that's going to come with just making sure that you have appropriate levels of self-disclosure. And these are, things that are like a clinical risk and can basically make a lot of problems within a therapeutic relationship. But besides that, you really should understand some of the concepts of digital security, limitations on really where your environments, your client's going to be receiving services. So really, like, you have no control whether or not your client's spouse walks in on a session, or if their kid, has to like kind of be with them as you're working with them. Even, some systems, depending on what they are, you may not know where that client is logging on. So like, for example, a system like Doxy actually takes a shot of the client before they come onto the session, so you can actually kind of see where they are in that image. But other systems like Zoom, you don't necessarily know. That client, you could have agreed upon meeting at their residence, you have their address on file, but then they join from a park. And then what if, they immediately start to disclose like things like SI? And for youth, especially who may, need to be out in other places, like a lot of our youth in Baltimore have a lot of issues at home where they may, try to pop out, not in their listed residence. And then so you really have to try to figure out like, okay, what you should do in that situation. And that really does take a fair bit of training for staff. This also ends up impacting mandated reporting, really, assault, abuse, neglect. You're in somebody's home. So the truth is you may just see more things even in the background and how that impacts, basically those safety concerns. And also really just having good training around crisis situations and how you make sure that you manage those issues. Besides that, with telehealth, really, I would say that there are some, folks who they just really, it's telehealth is just not the best way to have a clinical intervention with them. I would say, especially those folks who are high risk, who sometimes can be manipulative. You have to watch for obviously like complex trauma and personality disorders. I would say that generally, especially people who have a difficulty connecting virtually, that may also be a thing where, if you don't have a good therapeutic relationship with someone, this might not, be able to have telehealth sessions. And for my organization, we still have in-person meetings. We have them right now with plenty of policies and protocols in place to make sure everybody's safe in terms of COVID. But you may have to look at, again, where are we going to draw the line with clients who may not be appropriate? Next slide, please. Perfect. And just a few things to help people stay safe. So really train your staff and even train your staff how to manage breaches. When I typically train my staff, I have, we do it for both webinars and for individual meetings. I give them specific things that they're supposed to set up. And then I attempt to breach the stream. And it helps them to see what it looks like. It helps them to see what it feels like, and also how to kick people off. For our youth events, for other organizations that we've worked with, they have been, kind of Zoom bombed or, bombed via Facebook Live, and really making sure that you can manage those issues. We haven't had issue with it. We had one youth event where someone did try to come in inappropriately, was actually nude. But it was immediately stopped and recognized before any youth could be exposed to it or any harm could be had. So you really want to make sure that that's something people feel comfortable with. Individual counseling, really generally, again, there's some differences state by state, but ensuring the location of the client every time, ensuring the location of your staff every time. There was unfortunately a case where a counselor had a heart attack on a session with a client, and the client didn't know who to call, but the client can see that, their counselor is keeled over. And it took about 15 minutes to kind of figure things out before EMS got there. And unfortunately, the counselor passed away. So you want to even consider those types of emergencies. Making sure that you have emergency contacts on file, again, both for the client and for the counselor. And ensuring that if there's a problem with the communication via the platform like Zoom, that you have a backup, that people know, okay, I'm going to give you a call if the stream ends suddenly. For group counseling, you really want to have the same things. The only thing I would add is just making sure that you have group norms, just like any other group, and really just making sure that you also stick with them and kind of have a safe place. Finally, for events, I would just say you want to make sure you have proper registration and consent, but most of that can be done on the front end. Next slide. The last thing I'll talk about really is this, or one of the last things, I'm pretty sure this is the last thing, is really just getting client feedback. So these were actually some quotes that we had from our online art therapy group that we've started. And I thought that they were very poignant for just really highlighting that a lot of our folks miss the community and they miss the culture. Next slide, please. And finally, the benefits is really just access to care. You get to see people's homes, which can be really nice. You mitigate issues of risk in terms of COVID, in terms of illness, in terms of transportation. We've actually had several Two-Spirit clients that have gone through like transition, and they actually would have had a hard time getting a hold of a counselor if it weren't for the ability to do telehealth. And then groups, it really helps people to be together in a decentralized place. So next slide. Then the last thing is really just have fun. Use backgrounds, use filters, use virtual tools, have games, send materials, like have fun with youth and really like hopefully enjoy the space. Next slide. So thank you all so much. I have my contact information here, but then we'll have some questions later. And then if we go to the next slide, we'll pass it over to Shane.
That was really great, Dustin. I appreciate your knowledge around this. Delahant Shachanila for having me today. Shane Lopez-Johnston, Tolowa Dini Nation. I work for the Native American Rehabilitation Association of the Northwest, located out in Portland, Oregon. And today I'll be talking to you a little bit about some of our telehealth programming and some of our prevention activities and how we incorporate multiple services through our virtual platform at this point in time. So next slide. So this is who NARA is. You can read through it. I'll talk through it very quickly. So NARA has been providing 50 years worth of service with a cultural intent to help people through addiction, is how it first started. And we've spread over the 50 years into, kind of all areas of behavioral health, youth and adult. For A&D as well, youth and adult, we have the only Native youth addiction youth residential treatment center in Oregon right now, and the 9 federally recognized tribes have committed to providing that as an opportunity for their youth to become sober. The program has expanded into clinical services, dental services, so really an encompassing kind of program to all of our needs as Indigenous people. I think one of the pieces that really helps drive us is obviously culture. It's the pillar in which we've built our program around, and being able to provide a holistic approach to healing and implement as much cultural and tradition as possible into those services so that we can connect with our Indigenous people. Next slide. So what is telehealth? So obviously during the times of COVID, telehealth has become this incredible topic, but we were really doing things like this prior to, right? We've tried to reach out to rural parts of our communities in the past, and I think telemedicine and things like that have all been addressed. But with the COVID-19 pandemic, it really put a precedence on how do we provide access to our community, right? And so telehealth uses technology to provide care that can be treated with virtual supports, right? So this is not, I broke my leg, I'm gonna call or video in to have you, fix my leg. These are things that can be addressed with a person over, a Zoom link or a Skype link. We talk about these all the time. There's a ton of different platforms. Dustin is very well versed in it, so I appreciate having him go first in this process. NARA themselves use Zoom, and we use our HIPAA encrypted Zoom link so that we're able to do that. My recommendation for sure, if you're looking at starting your own program or even joining one to be able to receive services, is definitely ask what platforms are safe and meet HIPAA requirements. And I think, this goes along the lines of, if you're checking in for your own program, you want to make sure that your clients and your community members that are going to be signing up have their data protected, have their PHI protected, and things like that. Depending on what type of telehealth you're looking to receive, there could be a number of different options available. I highly recommend seeking advice from professionals before deciding if you or your clients may be qualified. I know a lot of us maybe aren't providing these telehealth ourselves, but are referring our clients or community members to telehealth. And so being an advocate for them, making sure that you check on all of those things prior to doing your due diligence, also really, really important. So next slide. So why telehealth? And, with the pandemic, it makes sense, right? There's, access to in-person care this time is incredibly limited. I know that our providers are providing a majority of virtual services only, almost 90% to 10% at this point in time. Whereas prior to this, it was the exact opposite at 90% in person and 10% virtual. And at this time, NARA itself is operating at 110% increase, actually, based on the availability of what virtual services have been able to offer. So we've been able to increase our access for our community so that people are able to reach out at a higher rate. It reduces exposure to COVID-19. I know, people putting gloves on and masks on and making sure they have their hand sanitizer, and all of that can be a hindrance, right? It's like this thing. I know when I have this beard here, like putting on a mask isn't the greatest feeling to go out. But I know that people have mask anxiety, and so things like that, telehealth allows them to be more comfortable with their space. And then that moves me to the next one, treatment from the comfort of your own home, right? From your own couch. Maybe you got sweats on the bottom, but you got your collared shirt on the top. You feel comfortable, you feel confident. Those are things that go a long way into creating an atmosphere in which clients feel safe to be able to share maybe that environment that they've already cultivated at their house allows them to open up more to their provider. So travel time, right? We talk about, I have to take maybe public transportation to be able to get to my meeting. And that can be a stressor for people that, let's say they have kids or they get done with school aid, or, traffic happens and all of these things. So that travel time is completely cut away when you have your telehealth. Your shorter wait time to see providers. We've seen an increase in time and response for our behavioral health at this time through virtual services, which is really great. I know when you're feeling like you need to see somebody right away and they tell you we can see you in a month or a week or whatever it may be, can seem like a lifetime, right? And at that point in time, that may be a deterrent for you to be able to feel trusted with that program, or that you feel like you're being, your time is being invested with them. And so that's a tough time. There's a couple other things that I've talked about for this slide, and that's the youth really like technology, right? And so as awkward as we feel as adults, or, getting to be older, that technical piece could be difficult for us, they really love it. They enjoy being a part of that. And then also those that are dealing with disabilities. Disabilities allows people with disabilities, this allows them an option to be able to not have to worry about that travel, right? Or not have to worry about getting from one place to the next, and they can just hop right on. Now, there are some disclaimers here, and I think Dustin talked a little bit about them as well. Not everybody has access to virtual services. The technology piece, not everybody has a tablet they can just pull out, and not everybody has reliable internet service. I know that we work with families that are homeless, right? Or moving around from place to place, couch surfing. So they might not have the availability to just hop on anytime they want. And so trying to find ways into making sure that those are the people that we're reaching out to for this next step, right? This first wave of telehealth is like, we're all kind of just dipping our toe in, and that's what's going on. But for this next step, how do we increase accessibility for those that don't have it regularly? And so coming up with creative ideas and maybe finding hot spots where we can have people come park in the parking lot and have accessibility to the internet through that, or talking about kind of what Dustin did, where they were able to buy tablets to be able to hand out to clients and things. And so all of those are really new. And I think any idea is really welcome. Conversations around that are really important. And so keep that in mind, definitely when you're thinking about who you're going to reach for this and why. Next slide. So I put Tele-Prevention in here because I'm the prevention director, and I feel like prevention is an incredibly important piece to creating a relationship, to even being able to get to telemedicine itself. Some of our youth are more comfortable in the process of coming in through the door, which doesn't have a counselor or somebody that they have to talk to. They see prevention people as maybe friends, or people that are, they can talk to without having it being documented. Yes, we are mandatory reporters, which we do share, but prevention is really, really important when we talk about, especially the continuum of care, right? Where do we sit on that? So the continuum of care obviously covers the lifespan in which these clients are receiving their treatment. And so it's important when we talk about integrated services, right? How can we best support our clients when coming together? Well, with youth, a lot of the times our prevention messaging is woven throughout our entire process with them. It's what allows them to step outside of their box and try something new, right? This allows them to come to activities and see other youth that maybe are going through the same thing, where they realize that they aren't the only ones that are dealing with this. When they see that they can become more comfortable within themselves and start identifying what it is that they can use to help them kind of grow. So the prevention program can be used the same way in telehealth, right? We talk about getting our contact, setting up our meetings, providing activities for them to be able to do, but all through a virtual component. Culture is prevention is probably the strongest message that we have in our prevention field. We highly feel that if you involve youth in their culture at an early age, that this helps them to develop protective factors against the daily risk factors that they have. We know growing up that we did not have the same reachableness, I'll use as a word, at our homes, right? We didn't have this internet like process where you can constantly be bullied or reached or whatever it may be. We grew up with the phone and dial-up internet and things like that were just not part of this. And I think being able to create a secure place for people to feel at their home, like imagine feeling alienated at your own home, right? Those are things from outside factors, not from family members or things. I know people deal with that as well, but outside factors being able to penetrate your safe space at home is really scary to think about. And so giving them this cultural strength, help them find their identity, connect them to the things that give them power for not only their like physicalness, but their mental, right? Their spiritual state to be strong enough to say, I'm not going to deal with your stuff today. I'm stronger than this, and I'm bigger, mentally than you in this capacity. And I'm just going to write you off. And being able to give those kids the skills, right, through these prevention activities is really important. Next slide. So the youth prevention program at NARA has a number of different examples that we've shifted to. I would like to just go ahead and put a disclaimer out right away. In no way do I feel like the virtual aspect is better than meeting in person. There's just an incredible medicine that's given to us when we meet together as Indigenous people, and we share and break bread with each other, and the laughter, the hugs, the connection. Okay, so in saying that, this is the second best thing we have available right now. So we have virtual culture nights. It's important to remember to address NARA is not a tribe. We do have a board of directors and a group that helps direct some of our cultural messaging that are called the Culture Keepers. We run everything that we're going to do by them before we do something to make sure that it's culturally appropriate to even share the culture that we're going to talk about. So make sure that you check, is it okay to share this prior to you doing an event. Virtual youth conferences and webinars. We just held our third Walking in Balance Part 3 Spirit of the Horse webinar. Our next one is going to be around physical fitness. Our first couple were really around just kind of motivational speaking. We had Billy Mills come on, who was incredible. Levi Horn, who's a former NFL football player, now a native alcohol and drug counselor up in Spokane. Judy Bluehorse Skelton, who's a traditional foods and medicine person, and Dr. Cornell Peeweewardy, who's a professor of indigenous pedagogies and education. So just trying to give these kids an opportunity to maybe connect with people that in other times we might not be able to afford to contract with to bring them out. And so this virtual way of reaching these people has been really great. We had some singers that have been influenced from, again, social media, right, is huge right now. Obviously, it's big, but social media, we have singers on there that have come, these traditional singers, and these kids are just incredible. So to be able to have them share their songs with us has been really great. Make sure when you're providing these, we've done them through a webinar style. If you have kids that reach out, make sure you follow up with them, right? That those are possible clients in the future. As prevention kind of goes, our door is that first door that a lot of people step through sometimes, and that's what gets them involved in the programming for other services. They start to feel comfortable and then allow you to kind of, progress in your relationship with them, being able to offer services. Zoom trainings, we've done suicide prevention, we've done LGBTQ2S, Two-Spirit trainings. We participated in a couple of great tobacco cessation trainings. We found that our youth residential treatment center has an incredible high use of nicotine products prior to coming into their treatment. And so we're trying to figure out how to provide virtual cessation groups, right? All of these things are kind of these new component. One of our favorite ones right now is our virtual music group. We've partnered with a group called Roots and Beats in the Portland metro area, and they provide a Wednesday group for all of our youth residential treatment center youth. And, it's been a learning experience for sure. This is our second round that we've done. The first one was 12 sessions long. And so we purchased iPads. We downloaded appropriate apps for them to have on their iPads. And then we had to really go in and do security for all of the iPads so that they can't access things that they're not supposed to on the internet, messaging, picturing, things like that. So make sure that you take that into consideration if you are going to use technology, that you're well-versed in your technology. And if you're not well-versed like me, that you find somebody that you feel comfortable with, and making sure that you can relay what you want to have done within your programs. Our virtual workout group is another big hit. Yesterday we did a circuit training with yoga. Some of the kids, and this is really important too, some of the kids weren't into it. And so our facilitator switched and did some karate and did some, self-defense moves, and the kids were really into it. I think reading the room when you're doing groups is really important. Finding stuff that you can involve them in that bring out their, spontaneity and their energy. And then our last thing that we're working on is creating our activity kits. It's a 12-week long, so 3 months, 1 day a week. It'll be an hour-long Zoom where we connect with we've created kits that we'll hand out to the community, and so they can participate in the groups with us, and we can sit down, and it's just face-to-face time. It's just cultivating a healthy relationship, creating some laughter, praying together, smudging, giving us an opportunity to really connect. Next slide. And so last but not least, we always talk about this, but remember to be creative, right? Take a healthy risk. But remember, you can't ask somebody to do something that you're not willing to do yourself. So if you're going to say, I want you to stand up and sing a song in front of everybody, well, you better be ready to stand up and sing a song right along with them. So make sure that you're following through on your end to show them that you're willing to go down that path of vulnerability with them. Okay? And then remember, it's not about us as providers. It's about those that we're helping. Too often are we stuck in our own heads. What am I going to say next? What am I going to do next, right? When really we need to just shake all of that off, and we need to just be there and be present for them. What sometimes feels like a failing situation or group to us could have been the group that inspired that person to want to go get more help, or to go talk to a person, or whatever it may have been that maybe been hindering them or holding them back. And we don't know that, right? So get out of your own head, allow yourself to be present, give them that energy, allow them to feel safe. And then, of course, create that connectedness and spread hope, right? Hope is so incredibly important during these times. I can't say it enough. If you can inspire hope, you're the person that's going to give them that time to be able to feel secure, to feel like they're confident in themselves, and to go on and move forward. So don't allow yourself to be the judger of hope, right? We talk about this all the time. Who's to say that high five, that handshake, or that virtual high five or handshake, or just remembering a kid's name isn't what they needed that day to get them through to the next day, or to be able to ask for help. And remember, it's about us creating a lasting impression on these youth. And so be positive, be energetic, and find yourself to be, someone that can help cultivate those relationships in a positive way. So that's what I have. Thank you very much.
Thank you very much, Shane and Dustin. That was just genuinely inspirational, and I think we really ended on a high point there. So thanks, Shane. We appreciate definitely you sharing all the tips and tricks you've learned during the last year. It can be hard to really look back and honestly remember where we all were at the beginning of this and be able to take that and turn it into a positive note. So I'm sure we all appreciate that. And I just want to give everybody a minute right now to think of any questions or comments they might have while we have Shane and Dustin with us to offer advice or insight on how this can be taken away for your own work and organizations. If you do have questions, we do invite you to just enter them in the chat box. I'd be happy to read them out. That was a water bottle. And we do have a question from Mandy, who asks, how do you encourage kids who need help but don't want to talk? You can answer in whichever order you please.
Sure, I'll go with this one. So really great question. I think you really have to find something that you can connect with the youth. And so being able to talk with them, find out if it's music, if it's writing, if it's sports, if it's culture, right? We've found with the youth program that we've had youth that have participated for over 3 months before they actually finally opened up about wanting to receive services. And I think that a lot of the time that's because these youth have been met with a lot of adversity in their life. And so there's lots of layers to peel back before they feel comfortable enough with their vulnerability to be able to ask for help from somebody that they feel like they can trust. As an adult, it's really important that we are true to our word when we're working with youth, that we follow through on the things that we're going to follow through to let them know that we do care for them and that it's important to us that they're safe, that they're healthy, and that they're well. A lot of the times when I'm doing my prevention groups or camps, these are the youth that sit on the side and tend not to participate. And so we find ways to be able to involve them in that activity. Maybe it's giving them the clipboard or the stopwatch, or asking them to help make rules. And soon we find that their participation levels, increase as the camp goes on. But it is a really good question. I think my ultimate response would be to show your consistency, to continue to work with them and show that that what you would like to see from them is something that they eventually will see for themselves. But yeah, I'd say stick with it and continue to work on it. Find creative ways for sure, I think. Yeah.
Yeah, Shane, that's excellent. And I agree definitely with your points. I know it's been a big issue for a lot of our youth in Baltimore, especially to try to get them involved. They tend to have more issue in terms of just like connecting, and also just greater challenges happening to them. I would say if you can get the parents on board, a lot of youth work, in my experience, like you really need like parents, really need somebody who's a guardian to help advocate. For a lot of the youth, especially for what Shane said, like meet them where they're at, if they want to play a game. I've been on sessions where it's like, okay, play a game in the background, or let's play this word finding game. even like our art therapy folks will use things like Zoom's interactive whiteboard or Jamboard. So like if you know the schools are using something that's going to be fun for them, try that. We also use token economies and incentives, just like we would use like for in-person therapy. Actually, our Native Connections grant that we have with the NCUIH helps with that, where we can send materials to youth, more events and toys, you know, basically just to keep them coming back and to make them feel like, hey, like just by coming and talking to this person, like I get something out of it. And then eventually you can hopefully find something that's a little bit deeper. And I see the next question just about privacy, and I'll start to launch into those. And then I'll pass it over to Shane for your thoughts. But yeah, for privacy, I know a lot of youth, like they may or may not have as many concerns. I actually know for a lot of our youth, they've actually been more concerned about their privacy and more concerned about like their family, like listening in. Usually, you know, you just, the informed consent process I try to go through with like the youth as well as the parent. Some things get a little bit gray between like your state laws, you know, like for Maryland, the age of consent for mental health is 16, but for all medical care, it's 18. So sometimes you have to like worry about discrepancies like that. Having a really, really good like tele-behavioral health consent packet, I think is really important. That especially like covers all your bases. And that can also just kind of help with any privacy concerns. And it's also something that like if you have good language and depending on the youth's age, they can see it and they can go through it and they can hopefully understand just where privacy sits. And yeah, Shane, do you have anything that you wanted to add on that one?
Not a whole lot. I will say with the social media factor becoming so popular over this lifespan, right? This is something that youth participate in. They share way too much on there a lot of the times. And, you know, I think that is kind of their generation, unfortunately. And so it's up to us as their mentors and elders to just remind them that, you know, what gets put out there is out there forever. And what you put out there could be how people judge you, right? And so making sure that they, you know, are conscious about maybe what's going out there and encouraging them to, if they are going to use social media, to use it in a healthy way. When it comes to privacy around, you know, these virtual telehealth, it's important. Dustin talked a little bit about, you know, find a room that you feel safe in, you know, a place. I know I'd had one of my clinicians share that one of their homeless families had been using the internet from McDonald's, right? And like, is that a safe space? You know, maybe it is to them, whereas to other people, maybe it is very much not so. So definitely take into consideration who it is that you're talking to, and also how they view the tool that they're using. I know youth can become very, you know, protective over their things. And so if this is how they want to be using things, just talk about healthy ways in which to use it. Maybe I would say definitely stay strength-based. You know, too often are we quick to jump to the negatives of things. Oh, you're going to make your family look bad by doing this, you know, and we go to the immediate, you know, down, you know, we want to talk about, wow, this is a really cool tool. Like, can you show me how to use it if I wanted someone to see how great this video is that I found of, you know, this inspirational speaker or something. So have them, you know, see the positive sides of things, but that's how I would kind of view those.
Thank you both for those answers and for reading from the chat. I don't want to miss the last question I think we have time for, is a question from Mary, who asked, with so many resources seeking to assist youth, which is great, but of course we're all kind of competing with offering virtual events, and how do you reconcile or seek partnership with organizations so as to reconcile that competing or conflicting issue? So methods or approaches.
Yeah, great question, Mary. I think the important part of this is the fact that there are things being offered, right? Those are the positive parts. Even if they're overlying on top of each other, we want youth to be able to access whatever it may be that helps for that time. I will say this: the prevention family that we have in Oregon is incredible. Our Oregon tribes and the state and NARA have a a calendar in which we all share, and we put all of our events on there so that we can either help support, encourage to go to, or change our date. You know, that's the other thing, to look on there and say, oh, there's already something going on. So I encourage you to reach out to your support network in your local area, see if you guys can create a calendar together, so that you can, you know, try not to plan things over on top of each other. But to be honest, there's just so many of us that Dustin said, you know, our programs are having a tough time meeting the requirements of our grants. A lot of our stuff has now gone to virtual stuff. So, you know, it's like, I got to do it. I'm sorry. I have to provide this. But again, I feel like, and this is something that goes to our spirituality, but Creator kind of drifts you to where you need to be. So those of you that are here today are here for a reason, right? And those of you that maybe didn't attend today and were on something else, that was because they drove you to that way. There's something that is inherently spiritual about why we're all here. And so finding yourself offering something on the same day or same time, you know, I think is fine. I think it really is. And if it becomes something in which is regular, find some time to meet with that organization and see if there's an opportunity for you guys to maybe pair up around what you're doing, or find, you know, another day in which you guys can help support as well. So that would be my recommendation.
No, that's great, Shane. And yeah, I think first off, it's an excellent question. In our area, we actually, I feel like, have less services for our youth. And we actually typically see that a lot of our Native youth don't engage in programs that don't have like a cultural component. This is also the same with even our like adults. So we may have some less competing programs. The thing I will say is, though, a lot of people get like digitally fatigued. Like people, you hear about being like Zoom fatigue. You hear about a lot of youth that's being tired of being online or staring at a screen that's not like interactive. And I think like even this, like this presentation, like I'm looking at a lot of windows and I see faces of, you know, varying shapes and sizes, but, you know, my ability to interact and to read any single one of them is diminished. So, you know, I think just trying to make sure that any of the activities that you have, like, have an energy. And I think Shane does a great job. Like, I love Shane for the fact that, like, you meet him for like 30 seconds and you're like, ah, this is why he works with you. This is like the perfect guy. But, you know, I think like having that energy for your events helps to, one, keep people coming. And then two, also, even if they are recorded, it does, I feel like, come through. And I think Shane made a great point about that, of just making sure your stuff is online via YouTube or on Facebook, or and that can really give people good access.
Well, thank you both for all of your answers and insight to the questions today. I think those are really useful suggestions, and I can speak only for myself, but I do not feel digitally fatigued from this presentation. Thank you very much. It was a pleasure to actually hear from you. I don't always get to do that as host, so it was really great. And I just wanted to close out our session since we are at the end of our hour today. So if we could just go ahead, and I'll quickly go through this. And I see from the chat that everyone else is very appreciative as well. So thank you. We do suggest that if you have the time to share with us what you thought, and if there's any topics you'd like to see in the future, please take the survey. It shouldn't be too long and it's totally anonymous, but it does help us to actually know and serve you better. And also to know how you'd like to see these presentations done, like if you need them more interactive or more time for question and answer. And I will put that in the chat box again, of course. There is going to be an email with all the survey and slide links as well, and links to the recording after this. So if you need to go back for any reason, you will be receiving that this week. Next slide. And we have a couple events upcoming as well. This next event for the SUNY COVID series is in April, the end of April, and that one will be Weaving Calm, which is a strength-based approach to addressing stress among urban Native youth. And that is going to feature Dr. Mary Swick from Johns Hopkins University. And then we also have a series on accreditation with a session on CARF, which Dustin is actually coming back for because he is ever the patient presenter for NCUIH. Thank you. And then we also have a Project First Line session on hand hygiene on March 30th. And then the final event is on the next slide. We just wanted to alert everyone to our conference that will be coming up the end of May this year, and it will be a virtual conference titled The Circle of Resilience, Empowering Indian Country in a Virtual World. But more will be available on that in future weeks. But without further ado, that is the conclusion of our session today. Thank you very much for joining us on this afternoon, morning, or evening. We really appreciate you attending and participating. I hope you all have a wonderful rest of your day. Thank you.